to my channel, and today we are going to discuss and practice a few SBAs of the embryology. And so starting with the question number 1. A 16-year-old primary Paris woman they presents to the early pregnancy unit with a 2-day history of PV bleeding. She is approximately 7 weeks into a spontaneous unplanned pregnancy. She is otherwise fit and well. Her serum HCG level is 94,000 international unit per liter. Which of the following statement best describes the origin and genetics of complete molar pregnancy? So the answer is A. The most cases, 90%, they are diploid as a result of an empty ovum being fertilized by one sperm. Now question number 2. What proportion of the primordial follicle they undergoes atresia to create a primary follicle? The answer is 99%, such that the 99% or more they can is the proportion of the primordial follicle undergo the atresia to create primary follicle. Now question number 3. With regard to embryology, which are the building blocks of the ribs and vertebrae? The answer is the mesodermal sigmoids. We have discussed in our reading lecture that the mesodermal sigmoids they are the building blocks of the ribs and the vertebrae. Question number 4. How many turns does the midgut go through in its embryological formation? We have studied it previously. It is the 390-degree rotation. Now question number 5. And the meconium is found in the fetal gut from which gestational age? It is the 14 weeks of the gestation. Meconium is found in the fetal gut from the 14 week of the gestation, but the passage of the meconium is rare before 34 weeks of the gestation. Next question. Question number 6. At what gestational age do the fetal breathing movements commence? It is the 12 weeks. The movements increases in the frequency and strengthen further on its in the gestational period. The movement they also increases after the maternal meals acidosis and are reduced by the hypoxia, maternal alcohol consumptions, and the sedative drugs. Next question. 7. The gonads develop from which cell layer? It is the intermediate mesoderm. The gonads and the urogenital system they develops from the intermediate mesoderm. Skeletal muscles, the skeleton, the dermis of the connective tissue develops from the paraxial mesoderm, and the lateral plate mesoderm they develops in the serous membrane of the body. Question number 8. The inferior 1/3 of the anal canal they originates from which structures? It originates from the ectoderm of the proctodium. The junction between the superior and inferior part is delineated by the pectinate line just below the anal column. The endoderm of the hind gut they develops into the superior part of the anal duct. Question number 9. The yolk sac they rapidly degenerates before birth. In the rare occasion, it may persist to develop in which conditions? It is the Meckel's diverticulum. A part of the Vitelline duct. Meckel diverticulum, it is a part of the Vitelline duct within the abdominal wall and persist. They forming an omphallomesenteric fistula, omphallomesenteric cyst, or ligament. This was first described by the G.F. Meckel in early 19th century, and volvulus is caused by abnormal rotations or fixations of the midgut. Question number 10. Implantation of the embryo they occurs at which stage? It is the blastocyst. Within 24 hours of the fertilization, the zygote they undergoes the cleavage, and it then further subdivides into the blastomere. By the 3rd day, the embryo they contains 12 cells. By the 4th day, it is comprised of 1632 cells and is called a morula. On the day 5, the blastocyst they hatches from the zona pellucida and implants into the endometrium. For in vitro fertilization, the transfer of the embryo with the blastocyst has been shown to be more effective and is recommended within the single embryo transfer. Question number 11. In the development of the oocyte, when does the second meiotic division they occurs? It occurs at the fertilization, and the primary oocyte they resume meiotic maturation in response to a surge luteinizing hormone, and this results in a polar body. And the secondary oocyte The oocyte is then ovulated and enters the second meiotic cells. It is arrested in the metaphase 2 and only completes meiosis after the entry of the spermatozoa at fertilization. And question number 12. The canal of Nook is associated with round ligament. The answer is round ligament. The round ligament arises from the body of the uterus and antero-inferior to the corona. It passes through the layers of the broad ligament around the psoas and the external iliac vessels, and it then passes through the deep inguinal ring and then inguinal canal to the labium majus. And in the fetus, the round ligament is surrounded by the peritoneal processus vaginalis, which is obliterated at the birth but may remain patent as the canal of Nook. Question number 13. A 40-year-old woman undergo the amniocentesis for Down syndrome screening. The karyotyping was normal. However, alpha-fetoprotein day was found to be elevated. Which of the most likely pathology diagnosed by the ultrasonography? It is the spina bifida. And alpha-fetoprotein is a glycoprotein which is synthesized by the three fetal structures, the gut, the liver, and the yolk sac. It may be elevated in the defect of the anterior abdominal wall and the neural tube. As these defects, they are not covered by the skin. Alpha-fetoprotein, they freely enters the amniotic fluid from the fetal circulation, leading to the elevation of the levels. Now question number 14. Which is the best indicator of the gestational age on the dating scan in the first trimester? It is the crown rump length, which is also known as CRL, and it is the biparietal diameter is appropriate for 14 after 14 weeks, and gestational age, the measurement they help in the early pregnancy diagnosis. Question number 15. And the intra-embryonic coelom, they forms within which structure? It is the lateral phase mesoderm. The answer is lateral plate mesoderm. In the second week of the development, the lateral plate mesoderm, they splits to create this cavity. It will form the space for the thoracic and abdominal cavity. Question number 16. Which sperm cell type they undergoes the second meiotic division? It is the secondary spermatocytes, and spermatogonium, they are the diploid and are divided by the mitosis to produce the diploid primary spermatocytes, and these divide by the first stage of the meiosis to create the haploid secondary spermatocytes, and secondary spermatocytes, they complete the second stage of the meiosis to become the spermatids, and the conversions from the spermatids is to sperm is known as the spermiogenesis. A cystic structure is noted lateral to the vagina, and this is believed to be the Gartner's duct. Which is what is the embryological origin of this structure? It is the mesonephric duct. And the mesonephric ducts, they forms a ureter and the collecting system, and in the female they can form the apophron, appendix, vesiculosa, and the Gartner's duct. Now the last question of this series. And how many oocytes are available at the time of the puberty? And there are the 400,000. The answer is 400,000. There are the 12 million primordial follicle they present at the birth, but throughout the atretic process only 400,000 or 4 lakh they are available at the puberty. So this is it for today, and I hope you like my video. And here it is confirmed that mostly questions are asked from the incidences. So incidences are very important, and I will suggest you to keep a separate book or a separate file for the incidences, as incidences are very important in the part 1 answers. And see you in the next video. Till that, take care. Bye bye.